Hello, and welcome to Preemie Chats, a place for parents and healthcare professionals to gather, share stories, and learn from each other. My name is Jenna Morton, and I'm one of three co-hosts who present this weekly series on behalf of the Canadian Premature Babies Foundation. I'm a career broadcast journalist and a preemie mom to twin boys who were born at 32 weeks, and they're now 11 years old. Before we begin today's talk, I'd like to acknowledge that I am broadcasting to you from the traditional unceded territory of the Wolastoqey and Mi'kmaq peoples covered by the Treaties of Peace and Friendship of 1726. Well, Preemie Chats is a creation of the Canadian Premature Babies Foundation, also known as CPBF. The foundation is a parent-led charity that helps families during and after their NICU time through education, support, and advocacy. You can see our website there on the screen, canadianpreemies.org. I hope you'll take some time at the end of the show today to check out the website. You will find all kinds of resources there. You will find recordings of all of our previous Preemie Chats, which there are almost 300 episodes now. When our discussion today is done, you'll find this video there if you want to share it with someone. There's podcasts. There's all kinds of resources and research materials. Most importantly, though, it's a way for you to connect with a community of parents and professionals who are helping our children thrive. Well, this is a parent-led organization, and this is very much a participatory event. And I do hope that you will let us know where you're watching from today in the comments, what brings you to us, whether you're a parent or a professional or someone in your life is touched by the topic. We'd love to know where you're watching from. And please, throughout today's discussion, feel free to share your thoughts, your experiences, and your questions for our guests in the comments. We'll have an opportunity to touch on some of those throughout this afternoon. Well, speaking of our guests today and our topic, I'm going to just give you a little bit of an introduction before I bring them on screen to join me. Today's topic that we're focusing on is preeclampsia, which is a bit of a sneaky and a secretive disease that sneaks up on some of us that we're hoping to shed some light on today. I'm going to be joined by two guests who have a wealth of knowledge from different aspects on this topic. I'm going to be joined by a mother as well as a researcher. Rena Brito is a mom of 4 young children, including a set of twins who recently turned 2. She was diagnosed with preeclampsia during her first pregnancy, nearly 7 years ago, and hypertension with her following pregnancies. And she's going to share some of her experience with us. And then we're going to also be joined by Dr. Isabelle Malhamé, who is joining us from Montreal. She is an award-winning clinical scientist and an assistant professor at McGill University Health Centre, specializing in obstetrics. And her research focuses on reducing severe maternal morbidity with a special interest in cardiovascular complications, which is really what we're talking about today. So I'm so glad that you're both joining us. Hello to Rena and to Isabelle. Welcome to Preemie Chats.
Thank you for having us. Thank you.
I'm sure that people are going to have a lot of comments and questions and things to share as we go through this topic today, because even before we came on here live, the three of us were chatting, and there's so much to talk about. But always, we like to really kind of start with those personal experiences. And so I think that we're going to let Rena tell us a little bit about her story before we kind of dive into more detailed discussions.
Perfect. I have a presentation prepared, but it's mostly just some information on what I collected with preeclampsia. So it'll kind of speak in complement to what I share with my story, but just not to bore anyone, but I just information I found on what it is. So it's a disorder that only occurs in pregnancy and postpartum women. It's characterized by new onset of hypertension and signs or symptoms of end organ dysfunction, such as kidneys, liver, platelets, lung, and brain. So it's diagnosed when there's a persistent elevation in the systolic blood pressure of 140 or a diastolic pressure of 90. It's a single elevated blood pressure does not make the diagnosis of hypertension, and other names for preeclampsia can be pregnancy-induced or pregnancy-associated hypertension or toxemia. The causes of preeclampsia, again, I'll I'll just kind of speak to my story, but I have so like Jenna had said, I have had 3 pregnancies with, surprise twins at the very end, the last pregnancy. But my story begins back in February of 2017. So I was overdue, by a couple of days, and prior to me being overdue, I had fallen down our stairs and in our, 2nd story home. I was okay, baby was okay. I think I even, went into, the hospital to just have baby checked and everything was fine. And I remember the doctor asking me why I fell, like if I had any recollection as to why I fell. And I said to the doctor that I have low blood pressure. And so he saw that on the monitor and he's like, "Yeah, you do have very low blood pressure." And I said, "Yeah." So kind of went about my pregnancy. That happened around 35 weeks. And right after I had gone to my appointment in Alberta, where I'm from, unless you're deemed high risk, you don't necessarily see an obstetrician for your pregnancy. You might see a midwife, you might see a a clinic of doctors, and that's what I was seeing. I was deemed low risk. It was my first pregnancy. And so I went to that low risk clinic and I saw a doctor, and I remember them measuring me and saying, "You're measuring a little bit small." And I said, "Oh, I get comments all the time that I don't look quite pregnant." And they didn't seem too concerned at the time. But I remember at 37 weeks, the doctor, it was the same one, said, If you're still measuring 2 weeks behind, I'd like to maybe do an ultrasound next week to just check on baby, make sure everything is fine." So again, I didn't think anything of it. And I remember seeing my blood pressure at 37 weeks, and I kind of thought it was a little bit high. But again, being a newly pregnant person, I didn't say much. And I remember going to the 38-week appointment, because at that point I was seen every week. And I mentioned to the new doctor, that the previous doctor from the week before said if I was still measuring small, that I was probably going to have an ultrasound. And they kind of um, questioned why I said that and didn't really acknowledge what that previous doctor had said. And I remember saying to that doctor, "My blood pressure is high." And I remember that doctor saying, "Well, that's just kind of a sign of, you're getting towards the end of your pregnancy." And I said, "But my blood pressure is always 90 on 60, which is quite low." And that doctor kind of just said, "Oh, yeah, well, we'll see you next week," and just kind of go about your time. And so I remember the 39-week appointment, my blood pressure was high again, and I mentioned that to them, and I was still measuring small again, and mentioned the ultrasound thing again, and they just kind of, again, it was another doctor. And then I hit the 40-week and 2-day mark, where I went in thinking, I brought my husband with me, went in thinking I was just going to be told, "You're overdue and you'll hopefully have a baby soon." And my blood pressure was, I believe it was 170 on 120. And that doctor said, "Something's happening and you're going to have to go to the hospital right now and you're going to have to be induced to have a baby." Thought, well, this is, and I remember saying to her, "My blood pressure's been high for quite some time." And she's like, I see that in the notes and I apologize, but now you need to go." So I went to the hospital. They were kind of waiting there for me. They gave me about an hour to get there. And I walked in and they brought me into triage and said, "Okay, we're just going to check your blood pressure. We're going to do some tests to see, if anything's going on." And I remember the nurse in triage saying to me, "Oh, your blood pressure is going down here. I'm sure you're going to go home." And I said, "Well, that's not what they said at the clinic." And she said, "I'm sure it's going to be fine." And she came in about 20 minutes later and she's like, "Actually, it's not fine. You have preeclampsia, and the doctor's going to come in and discuss with you what's going to happen." So at that point, we had already called my mom from Ontario to let her know she needed to fly to come because we were having a baby. And I remember the OB coming in and saying, "We need to do an ultrasound to see what kind of induction we're going to do, but we're going to have a baby." And I said, "Okay." She's like, um, I really want to make sure that baby's okay with the induction methods. Otherwise, we might have to do a C-section." And I said, "Well, I'd rather not have one because my mom's coming, first time mom, didn't know what I was saying." Anyways, nonetheless, I remember them doing an ultrasound and she's viciously scanning my stomach. And I'm like, "Is the baby okay?" And she's like, "Well, there's a heartbeat, but there's no amniotic fluid." And I was like, "What do you mean?" She's like, "There is one tiny pocket of amniotic fluid left right by his mouth. And she's like, "How long have you been measuring small?" And I was like, about 5 weeks." And she was flabbergasted. Her jaw just dropped, and she's like, "Well, I am taking over your care going forward." And at that point, the blood results came in, and it showed that my kidneys were starting to show signs of deterioration. And she's like, "Listen, like this is not good. I'm going to give you like 12 hours or less to have this baby vaginally. Otherwise, we're going to have to do a C-section. Or if this baby shows signs of any stress during labor, it's going to be a C-section." So I remember signing a waiver saying, "Here's my rights." And sure enough, my mom landed. But when it came time to about 10 hours into labor, I remember she had already switched over, and a new OB came in and said, "The baby's starting to show signs of stress." And I was like, "Okay, well, my mom's here." Sorry, I'm getting emotional. "My mom's here." I said, "You just do what you have to do." And I remember them saying, let's give you an epidural, and maybe that will calm everything down." So they gave me an epidural, and sure enough, his heart rate rebounded. Um, and then it came time to pushing about an hour later. And again, he showed signs of decelling. And I remember the doctor coming in and saying, "We don't have time anymore. If this last push doesn't get the baby out, it's going to be a stat C-section. So you're going to be put out. Your husband's not going to be there." And they got the whole entire room ready to go in case I had to go. And I pushed with all my might, and he came out, and the whole room went silent because he was completely unresponsive. They had lost his heartbeat. The NICU team was in there, and they were doing compressions on him. And they said, they were grilling everyone in the room as to why I didn't have a C-section and why this had happened. And I just remember looking over at this baby going, "What is going on?" I was in complete shock. And I remember them whisking him out of the room, and I was quite numb from the epidural. And my husband came back, and he was all upset, crying. And he's like, "He's got tubes in him. They're still not sure if they're gonna transfer him or if they're gonna leave him here." I'm like, "What do you mean transfer him?" He's like, "They're talking about maybe transferring him to Children's. He's like very, very bad condition." And I remember going and seeing him. They managed to stabilize him. I remember going to see him, and he had a collapsed lung from the intubation. He had swallowed meconium. He had um, a bit of a brain, like a pause in brain activity. So they were cooling him, and they brought a machine in to cool him. And I remember fast forward to 2, 3 days later, he had antibiotics. He was doing better. And I remember I think it was day 4, they said, "Okay, he can go home." It's just such a turnaround of events. So I remember being in the NICU and asking what happened. Like I said, "He's wrinkly." And I remember the neonatologist saying to me, "He probably lost about a pound in utero, from just my placenta just not working." And so fast forward to going to have a second baby. I was due in March. So you'll see the February 2019. So I was due March 14th. And this time I was seen by an OB, right away, quite quickly. So within, I think at 20 weeks, they wanted to see me. And I went in just with pent up frustration that this had happened. And I'm leaving out the part that I was actually readmitted for postpartum eclampsia because my blood pressure started to go up at the end, or I think it was day 3, my blood pressure started to go up. So he was in the NICU, and then I ended up being readmitted for a couple of days for magnesium sulfate treatments to lower my blood pressure, which if anyone in the audience has experienced that, it is very unpleasant. It makes you absolutely exhausted and tired and loopy. But anyways, fast forward to second pregnancy. I'm due in March, and I remember going into the OB. I'd never met her before, and I just said, "This cannot happen again. This is what happened to me. This can't happen again." And she put me on kind of a course of hopeful success. But by about 28 weeks, I had preterm labor. So I had some back pain that didn't know what it was. I went in, and sure enough, I was having contractions on the monitor. So they did some steroid shots. They told me that if labor progressed, I was gonna have to be transferred to a different hospital. But luckily, they stopped the labor, and at about 32 weeks, he was measuring quite small. So they were wondering if I had early signs of preeclampsia again because my blood pressure hadn't quite rose, but I was getting a little bit puffy in my face. Sure enough, he was fine. At 35 weeks, I started to measure small again, and I remember my OB prepping me and saying, "We're going for an immediate ultrasound today. If there's low amniotic fluid, you're having the baby today. Like we're just not going to take any chances again." And I remember going to this ultrasound, and again, my husband's there. The room is quiet, and they're scanning. And I remember the technician not saying anything, and then she went into the other room, and finally, the MFM, maternal fetal medicine doctor, came in and said, "I'm consulting with your OB. His fluid levels look great." And I was like, "Oh my gosh, this is amazing." And then we got to 36 weeks and scheduled an induction date for, I think, 37 and 4. And about 5 or 6 days later, I started to deteriorate. So I knew the signs and symptoms that I was experiencing the last time that I kind of ignored. I had real extreme headache that would not go away. My face started to get puffy again. I remember my husband saying to me, like, "You're really retaining a lot of water. Your face looks puffy." And I gained about 4 pounds in 5 days. And I said, "Okay, this isn't good." I remember going to out and about that day with our toddler. And I said to my husband, "I have to go in. I'm seeing stars. Like this isn't good." And sure enough, I went in and my blood pressure was high, but there was no protein in my urine, which was great. And the blood work showed that there was no preeclampsia, but they just decided to induce, and I had him at 36 and 6, and he was healthy and he was great. But I remember when they removed my placenta, the OB in the room said, "This placenta does not look healthy. Like this was just the best time to take him out because the placenta was showing signs of deterioration and not providing the proper nutrients to him." So yeah, then fast forward to thinking we were done having children and being blessed with a twin pregnancy. And they were my blood pressure was starting to creep again. I was on baby aspirin for my second pregnancy and 2 baby aspirins for the twin pregnancy. My blood pressure did start to creep again around I think the end of 29, 30 weeks, but I ended up delivering the twins at 30 weeks and 5 days, which is one of my draws into the premature foundation. Um, so I didn't quite I started to have hypertension in that pregnancy, but the pregnancy was quite early where I gave birth. When I was in the hospital for the second and the third pregnancy as well, they were very, very good about keeping me a little bit longer just to make sure my blood pressure didn't increase. And actually, with the twin pregnancy and my second pregnancy, it did increase again. So I was put on labetalol for both the second and third pregnancies. Um, and in my third pregnancy with the twins, because they were born at Foothills, they kept me in, I believe, 3 nights. And it did start to creep up. It actually dropped significantly, so they were worried that they were gonna have to give me boluses to kind of get my blood pressure up, but then it actually started to go up, and that's when they were happy they kept me, and they got me on 1 treatment on IV, and then I got to go home with oral medication. So that's my lived experience. Sorry if I ran over time a little bit there.
No, don't worry about the time at all. Thank you so much for being willing to share so openly about what we all know is not an easy story to tell and retell. I'm going to ask Dr. Malhamé if you could maybe come on and respond a little bit. We don't need to go into the details necessarily of what could have happened differently with Rena's case, but I think her experience is probably not unlike others that you've heard of, and have some thoughts on what we could all be doing on both sides of this equation a bit differently.
Yeah, absolutely. So I think, and thank you for sharing, Rena, your experience. And I'm really happy everything sort of ended well for your family. From what I hear in your story and the themes that can perhaps that resonate with other people who have experienced preeclampsia is that you're you were not necessarily recognized as having any risk factors for preeclampsia. The preeclampsia sort of seemed to have arrived out of the blue, and we know about some risk factors for preeclampsia. So I do, because the title of the presentation and the aim of the presentation is really to make sure that everybody comes out of the presentation with a good sense of what is preeclampsia, what could put them at risk of preeclampsia, how it could manifest, and what to do if you have preeclampsia. I do want to highlight that there are some risk factors that can be recognized in general. So having had a prior preeclampsia episode is a risk factor for having it again in a next pregnancy. Certain personal risk factors, such as your body mass index, certain medical conditions that you may have, for example, chronic hypertension or chronic kidney disease, or diabetes already prior to pregnancy, or having used assisted reproductive technologies, like, for example, in vitro fertilization, are considered increased risk factors for preeclampsia. But also other, perhaps less well-known risk factors, such as having had a small baby in a prior pregnancy, having had any placental problem in a prior pregnancy, a maternal age above 40, or having this as your first pregnancy ever, or having multiple pregnancy with twins or triplets. These are risk factors again, but I do want to emphasize that preeclampsia can still happen out of the blue without any known risk factors. So that's one first thing that I hear in your story. And once we do know that we're at higher risk of preeclampsia, if we do know that, there are some things that can be done to prevent preeclampsia. So as you discussed in your second and your third pregnancy, you were given a baby aspirin, right? You were right. So we don't have a lot of methods to prevent preeclampsia going forward, but a baby aspirin or two may be given to you by your healthcare provider. So that's one way to prevent preeclampsia. The other way to prevent preeclampsia is to incorporate a lot of physical activity in your pregnancy if you're able to. So physical activity anything where you exert yourself for about 150 minutes per week, and that can be accumulated over time during the week. So 30 minutes 5 times a week, and the 30 minutes can be 10 minutes, that are repeated 3 times in the day, like a brisk walk, or multiple times a day. All of that counts towards reducing your risk of cardiovascular complications in pregnancy, such as preeclampsia. So this is something else that can be done in your next pregnancy if you can and don't have any contraindication to exercise. And then recently we've been giving a lot of calcium. Calcium has been found to decrease the risk of preeclampsia a bit, but only among people who don't have a lot of calcium already in their diet. And so if you're already having 2-3 portions of calcium in your diet, the likelihood is that you're already getting enough calcium in your diet, and you don't necessarily need additional prevention. So I hear, that you've had subsequent pregnancies where you were more informed and more aware about preeclampsia, and that probably contributed as well to why things went differently in your second and your third pregnancy. And some of the things that didn't necessarily, that I hear made it perhaps more difficult in your preeclampsia journey was the lack of continuity of care, because you experienced, you went from one healthcare provider to another, and then not everyone was aware of what had been said in the previous pregnancy, the previous visit. So you kind of had to advocate for yourself at this point, and even you knew, that your blood pressure was too high for your usual blood pressure, and even sometimes if it doesn't meet the exact criteria for preeclampsia, such as the one that you highlighted on paper, you can still know that something is brewing and feels not normal for you. So I would trust that instinct, and that's one of the things that made you kind of be an advocate for yourself in that situation. So that's a great strength, but I know it's not easy necessarily to be an advocate for ourselves in that moment. And the last thing I wanted to highlight was the normalization of some of your symptoms. Like, when we walk through pregnancy for the first time, we don't know what's normal, what's not normal for us, and anything new, any deviation from what we've experienced so far in pregnancy can be welcome as one of the numerous new symptoms that we've had in pregnancy. Is like, okay, this is just another added pregnancy special perk.
Carpal tunnel.
Carpal tunnel, a bit of shortness of breath, the fatigue, the nausea, the things we know. And sometimes preeclampsia can look a little bit like normal pregnancy experiences, like bodily experiences. But I think it's important to know what are some serious symptoms of preeclampsia and what should really raise awareness. And if not in your healthcare provider, in yourself, if you do have that little voice that's telling you that something is not quite right and doesn't feel quite right, to be knowledgeable about those symptoms.
Yeah.
I'm wondering if we can talk a little bit about trying to find that balance, from a healthcare perspective, from the provider's perspective, of wanting to make sure that people experiencing pregnancy know all these things to look for without overwhelming and making people very anxious about all the unknowns in these kind of situations.
So we can the particularity of preeclampsia is that no preeclampsia is the same from one person to the other, from one pregnancy to the other, from one period in the pregnancy continuum. Like your preeclampsia while you were pregnant was not the same as the preeclampsia you had after delivery. So preeclampsia is a very has multiple faces, multiple facets, even within a single individual. So that's really important to know, that there's no cookie cutter approach to preeclampsia and how things will unfold. It's all person centered. It all depends on your personal circumstances, your personal risk factors, your personal manifestations of preeclampsia. So each preeclampsia is unique. But there are some features that everyone should know about. And we don't necessarily want to be repeating those symptoms every single time you have an encounter with a healthcare provider, but at least once or twice, or making sure that everyone knows what to look out for, particularly in the second and third trimester when preeclampsia occurs, I think is really key and should be so routine that it doesn't necessarily indicate the reason to become more anxious or more worried. Everyone should just be aware of those signs and symptoms. And that includes headaches that are not your usual headaches, with vision changes, such as the little stars you described, or loss of vision, or anything with your vision that is not usual, like flashes, chest pain or discomfort, with shortness of breath that is not the usual pregnancy shortness of breath, or that just seems to be a little bit out of keeping with what you've been experiencing, especially shortness of breath when lying down. If you do feel congested or pressure in your chest, that can also be a sign of preeclampsia. Pain in the belly that is not the usual cramping or the usual small contraction type of pain, but really a pain that's in the upper part of your belly that can feel like an indigestion, that can be an early sign of preeclampsia as well. And the one that we mention a lot is the swelling. But of course, swelling really can happen in the normal evolution of pregnancy, but swelling that is more rapid than your usual, or swelling that would usually go away in the morning, that just persists and that keeps on being there, that is out of keeping with your regular swelling, and swelling that affects parts of your body that are not usually swollen, such as your face, that should also be perhaps an indicator that something may be going on. So if you experience those symptoms, you can trust yourself if you feel that they're not normal, that these may be early symptoms of preeclampsia. And the ones that you've experienced, which for sure were not normal and led you to consult in the triage at the time, like the really bad headache and the vision changes, sometimes not everyone reacts to these symptoms in the same way. I have had, people I work with who have had severe blood pressure and severe headaches, who didn't necessarily come to the triage because they didn't feel like, making a scene of their headache, or they felt like maybe I'm just really, really, really tired. So I think it's important to emphasize that these symptoms are important without necessarily leading to anxiety. And The important thing to know is that once we diagnose preeclampsia, especially when we diagnose it early in the course of preeclampsia, this is where the risk of complications actually decreases, because we're able to treat the blood pressure to prevent complications related to very high blood pressure, because very high blood pressure can be dangerous for you as well as your baby. It imposes a great stress on your brain, on your heart, on your kidneys, on your liver, on your placenta itself. So very high blood pressure is really a medical emergency. But if we treat blood pressure early enough, regularly enough, with blood pressure targets that are precise, we can decrease the chances of developing very, very high blood pressure. So treating it early helps. The magnesium feels terrible. And the magnesium, like I can totally empathize. But the magnesium, when given appropriately for the right indication, can prevent the occurrence of seizures associated with preeclampsia. So it is important to receive magnesium when we need it. Hopefully we don't get to the point where we need it, but if we need it, it really is important to get it, because it can prevent a lot of complications for the mom. And I know that in this community, well aware of the care of preterm infants and babies, we do give magnesium as well for the protection of the babies. But in the context of preeclampsia, we give it also for the mom, even if the mom is not necessarily at less than 37 weeks. So it's a good medication to protect yourself when you have preeclampsia with more severe features. And then once we know you have had preeclampsia in pregnancy, the follow-up in the postpartum period becomes super important, which does lead me to another important point, is that preeclampsia, while it is associated with pregnancy, and as you mentioned, it does come from the placenta and it's thought to originate in the placenta, can still happen if the placenta is out, if the baby is out in the post-pregnancy period. So preeclampsia can also present for the first time in the postpartum period. So if you experience those symptoms in the postpartum period, these could also be symptoms of preeclampsia for up to a few weeks after delivery. So continue to be vigilant with what feels right and what doesn't feel right in your body. And if you have any risk factors for preeclampsia and you've been told to monitor your blood pressure in pregnancy, that would also apply in the post-pregnancy period, where after pregnancy, you do want to continue to monitor your blood pressure closely, at least during 3 to 6 weeks after delivery. So I think these are important points that are often not known to the community that I work with.
And following up on that idea of the things that we should know after a diagnosis, because like we say, most of the people watching this are probably people who have already experienced this or have some, it's touched them in some way. Long term, what do those of us who've experienced it need to know in terms of our health?
Mm-hmm. Preeclampsia, while it is a disease that really is limited to the period around pregnancy and delivery, leaves lasting marks on our hearts and souls and bodies. So it's not a neutral event. While it does get better and the high blood pressure in most instances will resolve and most laboratory abnormalities will also resolve, but they may not always. Up to a third of women will continue to have high blood pressure, even if they weren't known for hypertension prior to pregnancy. And some abnormalities in, for example, the kidneys, like having a little bit of remaining proteinuria, can happen. So most of the preeclampsia goes away, and it doesn't go away directly after delivery. It takes a few weeks and months to really sort of heal, and you have to give your body a chance to heal from the preeclampsia. It can, as you mentioned, Jenna, leave you at higher risk of cardiovascular disease later in life. Now, we think partly having preeclampsia is a form of cardiovascular disease. So it unmasks an underlying risk for cardiovascular diseases. So if you had, for any reason, cardiovascular risk factors or a strong familial history of cardiovascular risk factors, or if in your in your genetics you were at higher risk of cardiovascular disease and just didn't know about it, well, having had preeclampsia sort of unmasks that possibility that you may develop cardiovascular disease later in life. And so we don't want this to be the end all be all. Not everybody who gets preeclampsia will have cardiovascular disease later, but in your healthcare passport, in your own, life passport and journey in healthcare, knowing you have had preeclampsia is very important because it does signal an increased risk of cardiovascular disease later in life. But before we get to the later in life, like later postpartum period, I really think it's important to also keep in mind the early postpartum period, because most of the serious complications that affect parents and birthing people in the postpartum period in pregnancy will occur in the postpartum period when it comes to preeclampsia. So you experienced a very high episode of preeclampsia with high blood pressure and headaches, I believe. I can't remember if it was in your first or your second pregnancy, but it was actually postpartum where you had to come back.
The first,
and
yeah.
the
Yeah.
first and get, like, even if you were already known for preeclampsia and treated and you were delivered, it flared back up in the early postpartum period. So it's not over in the once the baby is delivered. So it's important to care for our cardiovascular health also in those first few weeks and months postpartum, to continue monitoring your blood pressure and to continue treating it, and to stay on the blood pressure medications and progressively take them off if we're still on them after we've delivered. And there are more and more different methods to be followed postpartum. Some people will be doing televisits now with the COVID pandemic. We have better access to televisits and to be able to follow our blood pressure more remotely with our healthcare providers. So that period is really important. And then at about 3 to 6 months postpartum, it's really important to also get in touch with your healthcare provider to reassess all the different aspects of your care related to preeclampsia, your blood pressure at this time, and the rest of your cardiovascular risk factors, such as your risk of diabetes, your lipids, so the cholesterol in your blood and the triglycerides in your blood. So these are important things to check at around 3 to 6 weeks after delivery in order to inform yourself of your potential cardiovascular risk later in life. And so to summarize, preeclampsia is something that in most instances, the acute manifestations resolve, but it does leave some marks in the body and does indicate a higher risk of cardiovascular disease later in life. And so it's important to be aware of this and to, do our best to decrease our cardiovascular risk in all the ways possible. That includes a heart healthy diet, healthful eating habits, incorporating as much physical activity as we can, limiting other traditional cardiovascular risk factors such as smoking, living a sedentary lifestyle, or alcohol intake. So these are more traditional cardiovascular risk factors, but preeclampsia is among those risk factors. But we don't have very precise answers as to who will be developing those cardiovascular diseases. So for now, the advice that we give is quite generic and broad. Anyone who has had preeclampsia would be considered as having a higher risk of cardiovascular disease and would need to be aware of this going forward. But in the future, we may be able to tailor a little bit more that counseling and to give you more information about your specific cardiovascular risk, but we're just not there yet.
Rena, I'm wondering if you want to share a little bit about it from the patient perspective of what you've done since going through this experience, and what you hope that the people watching, whether they're parents or healthcare providers, might take away from all of this information that we're sharing today.
Yeah, and it's great information. I definitely have noticed that my blood pressure has never quite gone back to the 90 on 60, or even like 85 on 55. It's kind of around that 100 on 60 or 100 on 65, which again is only 10 points higher, but it's my family doctor is phenomenal, and she has kind of reiterated to me that there could be things that come down from a cardiovascular perspective later on in life. But I would say I kind of attach myself to quite a few pregnant moms that have experienced this. And I am currently working with a mom right now who I was telling the ladies earlier before our call that probably should have delivered her baby at this point, but she's pretty adamant about making it to 38 weeks. So I usually they kind of come to me and say, "Hey, you've had this before. What are the signs? What are the symptoms?" I'm like, "Well, without my uneducated medical advice, I kind of guide them to, signs and symptoms that are posted or that are shared with their providers." But I definitely am on. I wouldn't say I'm anxious per se, but I'm more just trying to live a healthy postpartum lifestyle to reduce as many of those risk factors as I can. So, alcohol consumption, not doing that. Tobacco consumption, not doing that. Trying to go to the gym, trying to eat healthy, to just do anything I can to stay healthy and try to maintain a longevity of life. I don't know if that answers Jenna or not, but
Oh, it,
And
it, it does. Yeah.
and maybe if I can also emphasize something, the idea is not for everyone who has had preeclampsia to be very hard on themselves and feel very stressed about their cardiovascular risk going forward. The idea is more for you to be aware and to
Mhm.
keep that in your mind when later in your healthcare journey you do have encounters with healthcare providers, and perhaps in your late 40s or 50s, when you experience chest discomfort and you have no other risk factors, well, you do raise the point that you have had preeclampsia before, and that may allow for a different estimation of your risk for cardiovascular disease when you're seen at this time. So it's not for you to be too hard on yourself. It's already hard enough to be a new parent and to try to keep it together and to be healthy as much as we can. And all this doesn't need to happen overnight or in the first few weeks postpartum or in the first year postpartum. It's more a sort of lifelong um, thing to know about yourself, about your journey, and to bring it up when you feel it's appropriate to your healthcare provider, because there may um, and we know in cardiovascular care there are some disparities between the care provided between male and female individuals, and we know that women's heart conditions are also under-recognized and underdiagnosed because their risk factor profile may be different. And preeclampsia is one of those risk factors that are female specific and that may be important to bring up later on if you do have an encounter with a healthcare professional in the future and there's any worry about your heart health. So it's not meant to add any pressure to anyone, more to empower and to give you the tools to advocate for yourself when the time comes.
I think it's such an important message for us to really take in and to remember that, yeah, this is part of our medical history and could be risk factors for various things to bring up. I think just in my own journey of, 12, 13 years since my first pregnancy now, I don't think of it all the time anymore as something that I need to say when something is coming up for a health issue. I'm like, oh, it was so long ago. And then I'm like, oh no, there's a lot of history there. I should probably, because in our journeys too, we see so many different people. We do have to retell those stories again and again. Before we wrap up today, Dr. Malhamé, you, I think, would like to talk a little bit about kind of where we might be going in the future and some of the research that you're doing and how people, that might be watching and listening today who have some experience with this might be able to play a part in helping us learn more about what's happening.
Yes, absolutely. Thank you for this opportunity to talk a little bit about the work that we've been doing. So maybe because we've heard a lot of unknowns and things that are still a bit of a mystery about preeclampsia, and this disease is, as I said, like unique to each individual and has many different faces. So a lot of research is going on at the moment to try to understand better the different types of preeclampsia, the different sort of declination of the disease. And this is one thing that my research team has been working very hard to try to develop it over the last couple of years. And so we're interested in identifying if a blood test or an ultrasound could help us identify women at highest risk of cardiovascular disease and complications, both around pregnancy and a bit later after delivery. There's also a lot of research going on to know how to better tailor blood pressure management to each individual, because, for instance, Rena's normal blood pressure may be closer to 110 over, 100, 110 in terms of systolic blood pressure, but other people may actually be able to have a blood pressure that's a little bit higher. So in the treatment of hypertension, we target the same numbers for everyone, but people may need different targets at different times. So there's research ongoing for that. And the same medications may not work in the same way for everyone. And so understanding what medication would work best for each individual, depending on their own anatomy, their own physiology, the way their body works, is also an area that's in progress. And we touched upon it a little bit, but optimizing how to follow people who have had preeclampsia in the first few weeks postpartum is an area that we're really interested in as well in my lab. And lastly, what we really would like to be building and developing in the next few years is a community of people who are interested in improving pregnancy related care and pregnancy related health in general. And we've been fortunate to receive funding from the Canadian Institutes of Healthcare Research to develop a hub, or like a network of people around that theme related to pregnancy complications, so severe maternal morbidity, and that hub is meant to bring together different stakeholders from different perspectives, including persons with lived experience of pregnancy, including researchers and clinicians, of course, but it's largely driven by persons, the experience of people with pregnancy. So we would like to invite you, if you're interested in learning more about our hub and learning more about opportunities to get involved with our hub, as persons with lived experience or parents with lived experience. And we welcome the birthing individuals, the women and gender diverse people, but we also welcome partners, support persons, family members. It's a very sort of open hub, so anyone is invited to attend. And we do have an upcoming town hall that's going to take place next week on Thursday the 30th, and so I'd be happy to put the link to register for those of you interested and curious about learning more about our work and how you could contribute and join the hub. So I left it in the private chat. I don't know if this can go either in a banner below or in the
It should be there in the comments for people now if they want to be able to click on the link there. So yes, hopefully I can see Fabiola is chiming in already, saying that she hopes that lots of people will come and join the town hall, because we know that it's so important for the people who are doing the research to have access to people like Rena, who is willing to speak up and share her experience and hopefully then change things for people in the future.
Yeah, absolutely. We really want to be able to, whatever we develop going forward, to do it in a way that speaks to the priorities and the needs of persons who have gone through the experience of pregnancy and pregnancy complications. So yeah, absolutely. We welcome you all to join us at the town hall.
Thank you so much. And I want to thank both of you so much for taking the time to chat with us today, and especially to you, Rena, for opening up and sharing your story. I know it takes a lot to do that. And even when you're up for the challenge, it's hard to do it in the moment. So I appreciate you.
Emotions, hey?
Yeah. It does. Even listening to you go through your story, I'm like, immediately it's 13 years ago, and I'm back hearing similar kinds of things and thinking of like, oh yeah, I don't remember anyone ever following up on, what happened after my pregnancy, and like, oh, did I maybe there are things that could have gone differently. And so I think it's so important and so wonderful when we can have these moments to talk and hopefully start conversations among other people offline after this. And so thank you both so much for the work you're doing and for taking the time to join me today.
Absolutely.
Thank you.
Thank you. Thanks for having me.
Thank you both so much. And thank you to everyone who was watching and listening and following along. I know there were quite a few of you online with us today. And if you know someone in your life that you think should watch this, it'll be up on our website, which of course is canadianpreemies.org. You'll be able to find it on our YouTube and our Facebook channels and everywhere. So please do share and continue the conversation in the comments as well if you have something else to share. And don't forget the links are there for the hub that Dr. Malhamé was mentioning. I'd like to take a quick moment as well to thank our sponsor for this series, AstraZeneca, for their ongoing support, and remind you that Preemie Chats is happening here online every Friday afternoon at 1 p.m. Eastern Time. And I do hope that you'll join in next week when the topic is another one close to my heart, talking about multiple births. Take care.